Well, you know, I serve on the healthcare committee in the Senate, and it's very important to me that I get these issues right. And I feel like we are moving very quickly in a direction of privatizing Medicaid. And for me, that means walking away from responsibility for doing it right. So as much as I can, I want to learn about what healthcare providers, how they're thinking about changes in healthcare and where we need to go to with healthcare, so that I can represent good practice and good public policy well. There's a lot of skepticism in the General Assembly about whether or not government even has a role in healthcare. And when we talk statistics on the floor, people's eyes glaze over, because as much as that's important, I think there's also this kind of perception that, well, you can manipulate statistics, so I don't have to worry about that. But if you tell a story and you get someone's attention, that's kind of unassailable. It may not be the whole story, but it's a true story, and that's not deniable. And I find I am most effective when I can speak in first person about an experience I've had with someone I represent. I think people are worried that there aren't going to be enough doctors, and I think they're also worried that if they get sick, they're not going to be able to pay for it. And obviously, not so obviously, but we also have this opioid epidemic, and people who are dealing with that or have family members who are dealing with that, getting services for those folks is extremely challenging. Mental health is another big issue where I get a lot of calls, and they're heartbreaking calls, because these are people who want to be well, but they need help getting there, and those services sometimes just aren't available. Well, that we understand each other a little bit better and begin to work together around making the situation better for all of us. That's why I do this job.